Ottawa's finance department projected health care costs out into the year 2040, a projection out. And summarizing it, the report said this, quote, in discounting that it was unsustainable, theories that rising health care costs will bankrupt federal and provincial governments are wrong. Note this words, government's share of total health care spending for the country will likely remain less than 10% of the size of the Canadian economy, end quote, to 2040. Now that's Ottawa projecting outward. But then there's another study looking at it retrospectively. It's a Canadian public policy study. And what they did is they actually studied the expenditures, not the projections, but the reality of the provincial governments from 1988-89 straight through to 2004. And their conclusion was, quote, there is no evidence that increased provincial government health expenditure resulted in lower levels of spending on other categories of government-provided goods and services, and also supported the 10% GDP figure. As I say, there's much research on this. But the point that I want to say by these two examples is that prospectively and actually, all of the research shows that public financing and delivery as we have it does not cause the limitations on other government programming, and it is not the source of unsustainability if there's a threat to that. I argue this evidence speaks to the value of Medicare around coverage and redistribution, but more. If you look at the OECD study last year, and I'm speaking to them later this month in Istanbul, the Canadian system contributes to health outcomes that are, on the whole, more often better than not, better than those produced by the United States and, in fact, much of the rest of the world. And let's not also forget one last point. On a pure, hard economic basis, this is an advantage to our business community and to our workers. For example, the auto industry, very important in Ontario and for that matter for all of Canada, a sector that generates billions of dollars. In Canada, that Canadian auto industry holds an advantage that amounts to at least $4 per hour US per worker less as compared to the United States. So I would argue, instead of viewing public spending in health care, innovation and reform as unsustainable, which the evidence doesn't support, let's acknowledge the research. And the evidence and the research demonstrates that it is both sustainable and critical to our nation's social and economic well-being. It's an investment in the future of a stronger Canada,